Good afternoon and good morning, everyone, and welcome to Has There Been Any Progress on Labor? That's a big question these days. And it's great to have so many people join us today, but especially our two esteemed panelists, whom I will introduce in just a minute. But first, I want to go over some administrative details about today's webinar. If you have any technical difficulties in the next hour, please reach out to Irving Levin's customer service at 203-846-6800. If you have any questions for today's panelists during the conversation, you can enter them in the Q&A box on your screen or email them to info@levinassociates.com, and we'll do our best to get them answered in the hour. And if not, I or one of the panelists will follow up afterwards. Finally, at the end of today's webinar, a brief survey will appear, and your responses are greatly appreciated. We use those to improve our future webinars. And also there's a question where you can submit future topics, and those would be great as well, because we are currently looking to get our 2024 webinar calendar out. So any feedback on just the course of the webinar and future topics is greatly appreciated. And also the slides for today's webinar were just posted in the chat box below, and that just has our speaker bios and the agenda for today. But now on to our panelists. Barb Clapp is the CEO of Dwyer Workforce Development, an innovative not-for-profit that works to connect underemployed individuals to the healthcare industry and provides them training and entry-level job positions to launch their new careers. The company has significant footprints in Maryland and Texas, but its services and mission could really be translated across the country, I would say. And in the fall of last year, the company closed on the acquisition of a 50-property skilled nursing portfolio in Texas for $590 million, adding a huge group of facilities to apply these practices that we're about to discuss on labor attraction and retention, and to, that portfolio can be used to measure the success of your programs, I imagine too. Great to have you on, Barb.
Thank you. Yes, it's great to be here. I appreciate it.
Absolutely. And then we have Steve Laforte of Cascadia Healthcare, which is a growing regional owner-operator with skilled nursing facilities across the Pacific Northwest, Arizona, and New Mexico. Cascadia has been growing by both acquisition and development in the last few years, going from 25 facilities to, I believe it's 57 now, Steve? 54. Just in the last year and a half, basically. So Steve has definitely seen the effects of a tight labor market firsthand as he's added those new locations. So it's great to get his perspective as a private owner-operator here too. He's also spoken in the Idaho legislature on the sky-high staffing costs for SNFs. So I'm not sure which setting is a more prestigious place to speak, here or there. But we won't offend Idaho with your answer. But welcome, Steve.
Thanks, Ben. Good to be here.
And I have to first start with the fact that both you and Barb joined me for our last labor webinar in October of 2021, which was called Labor, Finding It, Retention, and Coping with Higher Wages. And Levin Pro LTC subscribers can view that webinar if they so choose on our platform. And this is really a unique opportunity, having the same panelists essentially say what worked from the potential solutions we talked about last time, what hasn't worked, and what still needs to be done in the industry. Because back then, I think it's probably fair to say that we were in the depths of the labor crisis post-COVID. And now I think few would say that we're totally in the clear, but things may have gotten a little better. We'll get to that in a second. But we have the threat of a minimum staffing mandate, rising wages in other industries that are potentially attracting our staff, our potential staff, and just the general difficulty of working in this industry. We have to find the right people to do these jobs. And with the oncoming demographic boom, we'll definitely need to staff our new properties just to let new residents in and to care for them, which will involve a lot of work. But we'll get to that throughout the hour. First, can both of you kind of give me a progress report on the industry's staffing issues, but also those at your own businesses or local markets compared to 2 years ago when we last had this conversation? Barb, do you want to kick us off?
Absolutely. So I run two businesses. I run the 64 skilled nursing facilities in Texas, which is the Regency portfolio. But I also started and am running the Dwyer Workforce Development Program which is an innovative program that helps people who lack opportunity, improves the healthcare staffing crisis, and improves the lives of seniors. So our mission is about improving staffing. And and I have a unique perspective as an operator and somebody that runs a workforce development program. And staffing issues still exist. I can't compare it to 2 years ago because we just acquired the facilities about 9 months ago. But I can tell you that they did exist over the 2 years, and they are improving because we are able, with our workforce development program, to place people in CNA positions in our own facilities and others. We work with other facilities throughout the country. So yes, it exists, but I think we're seeing with melding the staffing issue with the workforce development program in our own facilities and others' facilities, I think it's improving.
That's good to hear. And Steve, what about you?
I'll start at the end and then work backwards. I agree with Barb. I think it's improving. And I think, for us, it's what you said 2 years ago. 2 years ago, we were still in the midst of COVID. Everything was chaos. And you had people leaving the labor market in droves. I mean, we know that the industry over the 3 years from 2020 until the beginning of this year lost 250,000 people. That we've only gotten in the last 6 months, maybe 50,000 back. So there's a shortage, but 2 years ago, everything was in chaos. And, for us, we had 25 buildings. Today, we have 54 buildings.
So the chaos was just compounded then.
The chaos was compounded, but in a different way, because you had to approach it in a way where, this is your primary focus. And I had one of our operators say to me, the mantra that he uses is where focus goes, energy flows. And that's how he views managing labor and managing the labor crisis. And so it's really been, the focus has been full court press. We took on a lot of turnaround buildings. They had staffing issues exponential. They had agency issues, and our focus became all about staffing and all about making sure our culture is stronger, our staffing initiatives are stronger, our programs are stronger. And with that, and coming out of the pandemic and, having a little bit more stabilization this year in terms of just how the world is working, what I'm seeing is stabilization. And that's better than where we were, and it's better than the chaos we were experiencing. And so from here, hopefully we build a foundation and we use what we've learned and use what we're employing, and things keep getting better.
And are you seeing stabilization in terms of like just total number of applications you're receiving for open roles, the just total number of unfilled positions you have across the board being less than before? Like, how are you seeing it?
Less unfilled positions, much less agency, and retention getting better. And I think for us, it's a lot about culture, and it's a lot of having the culture take hold amongst the employees you have. And, I think one other thing, and, I'm sure we'll touch on this as we go forward, but coming to the realization that wage scales have changed. And, in looking at our financials and in talking to our operational field, people, dietary housekeeping aides are making, just as an example, are making on average $20 an hour now. It wasn't that long ago, 5-6 years ago, that those same employees were making $11 an hour. And that was just the market. And we've had to adjust to a new market. And frankly, I think it's rewarding, because these people work in hard conditions. They work tough jobs. They're caregivers, and they're on the front line. So they deserve it. But it took the wider world changing for us to have to come to grips with our wage scales have to change. And we would rather pay them $20 an hour than have to be paying agency $40 an hour.
Yes, much preferred. And that takes me to my next question, which is again for you, Steve. Last webinar, I asked you how exactly the labor shortage was impacting your bottom line at Cascadia. And little did we know the inflation and capital costs just around the corner. But how have labor expenses changed over that period just in terms of your bottom line? I mean, I assume kept rising, but has it stabilized with that new kind of wage level?
It's stabilized because now we can plan for it. I think 2021 to 2022, you saw things increasing exponentially, and you saw the labor pool going down. Agency usage was going up because we were forced for it to go up. And so you had the confluence of all these things working against you. Now we know what the scales are, and they're not, the inflationary aspect has cooled a bit. What the wages we're paying have stabilized. I think employees are happy with higher wages. And I think then it's focusing again on the culture. It's focusing on the little things, because what we also find is not everything is about wages. It's about your job environment. It's about feeling valued. And those are the things that we're doing. It's celebrating people. It's finding ways to support your employees, whether it's then bonuses, it's giving out gas cards for, people's commute, it's meals, and it's creating celebration around some of those things. And you create these environments that people want to be in. And that's helped us to stabilize. And so when we look at the bottom line, I think for us, with COVID being essentially out of the picture, largely out of the picture, we're able to focus on census and building census. So our bottom line is stable from that sense. And one of the other things is, and this is not really our topic today, this is more operational, but it's coming out of the pandemic and looking ahead to the next 10 years as demographics start to change. How do we in the market distinguish ourselves in terms of specialization so we ensure sustainability within the varying markets we're in?
Yeah, that actually brings me to an audience question of ours, which either of you can take. Are there regional labor shortages across the U.S. that we should consider? Which regions are struggling more than others, and why? Barb, are you seeing any differences between Maryland and Texas, just as far as labor?
We're actually in Maryland, Texas, and Florida, and we are not seeing any differences. It's pretty equivalent, at least in that area. How about you, Steve?
Yeah.
I think where we see, I think there's two different challenges. We have a lot of rural markets. So, the 6 states that we're in, Idaho, Montana, Washington, Oregon, Arizona, and New Mexico. Idaho, Montana, a lot of our Washington buildings, some of our Oregon buildings are in decidedly rural markets. There you have the problem of your labor pool is smaller, but you also have less competition. So there's a bit of a balance there. In the urban markets, we have a lot more competition, but we have a lot more people. So it's sort of adjusting your recruiting and your retention activity to each of your different markets without ever wanting to fall short of culture and take anything for granted. I would say, though, I don't know that, other than some of our rural markets, some of the really small ones where we have, one facility in a town of 2,000 people. So your labor market is really small. I don't know that we see huge regional differences other than that sort of urban rural that I was noting.
Mm-hmm. Yeah, our rural facilities actually are very stable. We do not have staffing issues there. But it is more of the urban for sure.
Mm-hmm.
And I think that's a cultural thing too. What I see is people in rural communities support the facility in a more hands-on way. Their grandparents are in the building, or an old aunt and uncle, or somebody, they have a personal connection to that building, and it's a different sense of civic pride.
Yeah, they're like the heart of the community almost.
And then quickly, before we move on to the what has worked section, I just want to quickly touch on, are staffing agencies still present in both your portfolios?
We are using staffing still. We're trying to get more creative about scheduling, making sure all of our facilities are using our scheduling tools the right way. We're working on, it's not always about economics either. Like Steve was saying, we're focusing a lot on culture and making sure our staff are having their needs based. We have, because of the workforce development program, we do person-centered case management for all of our CNAs that have come in to our facilities in Texas since September 16th. And that person-centered case management requires a lot of coaching and a lot of workforce readiness. And we're finding that that is significantly improving retention and therefore helping our staffing issue.
I would say from our standpoint, agency is still out there. I will say this is a bottom line focus, Ben. With the federal money ending, 2022, we still had federal money. 2021, we had a lot of federal money. And so things were in that sense, bottom lines were much easier to balance. Coming into 2023, we knew that there wasn't going to be any more money. We knew that we were done, and we knew that in short order, at some point in 2023, as we know happened, the PHE was going to go away. And so how do you prepare for that? One of the ways we prepared for that was internally amongst our ops folks, we said, we've got to get rid of agency. And the focus, and again, where focus goes, energy flows, we have to do whatever it takes. And if it takes a short-term stop in driving census, then we need to do that. We need to look at whatever it takes, because this doesn't work. It doesn't work on so many levels, including how it diminishes culture. And so we've been really successful in the first half of 2023, and it wasn't without some pain, in largely weaning ourselves from agency labor. And strengthening our culture. And, for us, a lot of it too was, we had, as I said, from 2 years ago, we went from 25 buildings to 54. So we had a lot of buildings that we had taken on that had agency issues. And we had to redouble our efforts to lessen agency. I think going to a broader thing, I'll just leave this, and I think we're going to talk about this later. Is agency still a problem for the industry? Absolutely. And I think that needs bigger policy solutions and public-private partnership, more from our public partners, in terms of balancing how agency affects the industry. In most specifically on the negative side, but
not for the staffing agencies.
Not for the staffing agencies. No, I would agree with that.
And then just quickly, what is the kind of general composition of agency versus in-house employees that you're seeing at your facilities?
We're using mostly in-house, but we still are using some agency.
So like 95 to 5%, something like that.
Something like that.
Yeah, it's selective. From our standpoint, it's, on a PRM basis, but make it as short and sweet as possible.
Well, the agency staff, I think, is eliciting a lot of questions from our audience. So just one more before we move on to what has worked. One of our audience members had read a story yesterday that said a single building saved $94,000 per month by reducing agency labor to next to nothing. That seems unlikely, but for every dollar of agency costs that are removed, what is the cost of overtime or employed labor to replace that agency staff?
Steve, you're better to answer that question than me.
Well, I would say going to one specific. I had this pop across my desk the other day. In this type of granular stuff doesn't always cross my desk, but we have one of our buildings here in Boise. And for a variety of reasons, I was looking at different things. And in the second half of 2022, its agency labor costs were about $360,000, so $60,000 a month. As I said, in 2023, and this building was one that really had to buckle in. it's agency labor, and they made a concerted effort to eradicate it. Its agency labor is now in the first 6 months of 2023, $23,000. So, I mean, there's your delta is $60,000 a month to $4,000 a month, which is huge. One of the things that we found is that when you have staff that's yours and you work on culture and the people buy in, you need less people. You don't need, sometimes with agency, you need to overstaff because they're not doing their jobs in the same way, or you need more overtime. I think what we found is we've really strengthened our in-house staffing, and we've strengthened the culture, and we've strengthened the work environment. People are more available. People are willing to trade off shifts. So you lead less overtime and you create more balance, and you can do things with less staff without scrimping on staff, because staff is important. And I know we can talk about staffing minimums later, but staff is important. But when you have caregivers who care, and you have a community within your facility that cares and relates to the residents in a community style, family style way, I think it ends up saving on the bottom line in the long run.
Yeah, it'd just be interesting to know, as you eliminate agency, you were theoretically adding staff. And so what that change would be, could be an interesting, I guess, case study at some point.
I will tell you, I mean, I can look at this one facility as just an example. It went, from 2022, and one of the things it was doing in 2022 was ramping up census. Mm-hmm. So that last 6 months of 2022, when they had a $360,000 agency bill, a little bit it was the ends justify the means, because their census was going from high 60s to almost 90%. And so it was a huge change. But then when you shed the agency and you manage the labor a little bit more effectively, I mean, this building is decidedly profitable now, and increasingly profitable. And with the staff that they have, and with the specialization they have, I think that their census today is, and this is a 99-bed building, I think their census today is 95%.
Not too shabby. Well, let's move on to what has worked, which I think will be the meat of the conversation today. So just wanted to start off with I think this question could probably take about 10 minutes to answer. So I think we should probably allow that time, because this is where I want to hear about the successful strategies of the last 1.5 to 2 years, or since we last had the conversation, or Barb, since you took on the Regency portfolio. What have been some of the successful strategies you both have implemented to attract the right staff? Barb, do you want to take that first?
Sure, absolutely. So I think what has worked is the Dwyer Workforce Development not-for-profit world. It for sure is working, and the purpose of it was to help people who lack opportunity, but to also improve the healthcare staffing crisis and improve the lives of seniors. So we started it in June of 21. It's a 501c3, and our initial thing we did was we did partnerships. We incubated it here in Maryland, and we did partnerships with workforce boards and other not-for-profits. And we found people who lacked opportunity, needed jobs, and wanted to be in the healthcare world, or thought they might want to be. And what we've done is we've trained them to be CNAs. We've given them a career ladder. We will pay for them to be CNAs, but we'll also pay for them to grow in their career ladder all the way up to LPN, RN. And the differentiator, after we place people in job, other than placing people in jobs, we do person-centered case management. So from intake on, people can apply to us, or other not-for-profits or workforce boards refer to us. And at intake, we start working with people immediately and ask them, our case managers, we have a whole staff of case managers, social workers, who say to the person that would like to join the Dwyer Workforce Program, do you have any challenges? And the answer is almost always no. And then they say, do you have children? Yes. Do you have childcare? No. That's a challenge, right? Do you have transportation? No. There's so many challenges that we come up with, and that person-centered case management addresses those challenges from the very beginning. And that has been a big differentiator. So we do supply a lot of wraparound services to our, we call them Dwyer scholars, but a lot of what we do is coach them. CNA positions are low paid and they're entry level, and a lot of people do not know how to be work ready or overcome the obstacles that they face every day, or they're so used to hearing no, they don't know how to stay in one place and say yes. So our case managers really work with them. In the first year that we had the workforce program in Maryland, we trained 287 CNAs with an 84% retention rate. And we placed almost 90% in jobs. And this year in Maryland, we'll have 700 Dwyer scholars. In Texas, we'll have well over 1,500. And in Florida, we'll have about 300. So, and we're retaining them. There's anecdotal, we're collecting data on it, and it's early, as you know, but we're hearing from the employers that our scholars have better stick, they're more prepared, and they're doing a better job. And some of it is just matching them, like Steve said, to the right culture. But that it is really working, and I think it will change the industry, significantly.
Are you finding that they are most attracted by the career path that's being clearly laid out for them, or at least like the opportunities ahead of them if they so choose to join the program? Like, are you finding that they're attracted by the career opportunities, and then they're probably retained because of the educational opportunities you offer, but also just the emphasis on like not only eliminating the challenges, or not eliminating the challenges, but getting around the challenges, but fostering them to move up the career ladders? Is that?
I think the case management, just the day-to-day support of these people who, some of our Dwyer scholars start out living in their cars. And they're being moved into safe spaces. They're being supported by a person that maybe they never had. When you lack opportunity, you might not have ever had somebody model positive behavior or tell you you have value. And I truly believe that this case management is the differentiator, and it produces better outcomes. And of course, we get our some of our Dwyer scholars from other not-for-profits, and it's an opportunity. They've overcome something, or we get young people aging out of foster care, or young people in programs in city schools that can't afford to go to college but have enrichment programs. And these are people that other people haven't tapped into. And we are seeing them just soar. It's been phenomenal watching this program move people forward. So we have 1 year behind us. We have several people moving on to nursing school and staying in their jobs. And if things don't go right on the job one day, they'll call their case managers right away. And the case managers like, don't walk off your job, contact HR. If you walk out of that building, you don't have a job. And it's really making a difference. The other thing we've done, we were using a lot of technology for retention. So we developed what we call a Dwyer Scholar app. And it's an app that when we go to their class, we attend for every Dwyer Scholar's first class and every Dwyer Scholar's graduation. And when we go to their first class, we have them download the Dwyer Scholar app. And that app is like a gym app that gives you incentives if you go to the gym. So they get incentives if they check in on their app with their case manager. So if they give a thumbs up or a thumbs down or a thumbs sideways, which is the way they check in, and we start seeing several thumbs down, we know we have a problem, and our case managers reach out to them right away. But we also, this summer, we offered camp. A lot of CNAs quit in the summer when their kids are out of school because they don't have childcare. So this summer we offered camp for our Dwyer scholars' children, and they accepted it. They took it. They were excited about it, and that has improved retention. So that app has been a game changer for us.
Great to hear. And Steve, what in the last couple of years, what has worked to attract the right staff? And by right staff, I mean qualified, good fits for the industry.
I think some of the things that we've done mirror, what Barb was talking about and the experience she's seen. I think that, one of the first things, and this is easy because it's just a metric and we touched on it earlier, the wage scale has changed. And that allows us to attract and retain people in a different way. And I think that's a positive thing. But that in and of itself is more the macro environment. And we had to react to it. And then we had to come to a stabilization within our financial management of it. But I think it's more when I talk to our field, when I'm out in the field, when, the things that I see is it's high touch. It's high touch, it's culture, it's being attended to people. It's starting right from the start. The ads that we post and the recruiting that we do is very intentional, and it's very focused on who we are as Cascadia and what's different about us and why this is an environment you want to be in. And one of the things, with Cascadia, our mantra has always been from the start, be a force for good. But it's not just be a force for good. Force itself stands for family, ownership, responsibility, celebration, and experience. And the three things we focus on in terms of recruiting, and whether it's in our ads or it's in employment fairs, at association meetings where we can have booths set up, university settings where we can have employment booths set up when universities have employment fairs. It's focusing on family, it's focusing on celebration, and it's focusing on experience. And when we talk about experience, what we mean is the shared experience that we create within our employment milieu for the employees. And it's going on outings. Sometimes it's doing public service projects together where you bond in a different way, and then you go out and share a meal. But it's creating all of that where it's high touch with the employees. So from the first ads, from answering the ads, it's leadership teams following up on interviews, not just an HR person. It's the facility CEO or the director of nursing or somebody else in leadership reaching out to them post-interview to continue the recruitment effort. Mm-hmm. And then it's onboarding, and it's creating that onboarding experience that's really meaningful and brings them into the fold. It's giving people mentors in the onboarding process, where for the first several months, they're meeting with a mentor several times a week. What's working, what's not working? How do we make this environment better for you? Then it's career pathing. And it's, it goes to, what Barb's saying. It's bringing people in, and it's bringing people in. Some people come in as a medication assistant, and it's creating a path to CNA for them. It's creating the path from CNA to LPN to RN. And we're supporting that both, in terms of giving the people the time and in subsidizing their educational experience so they can go along that path. And that creates a different attraction and retentiveness for them. And then it's, again, it's little things. It's making sure that we create meal opportunities for our employees. And so, we celebrate with meals, and we celebrate with communal meals. It's our employees who have car issues and transportation issues, figuring out how we facilitate transportation for them. It's our employees in rural areas. Now, this would be an example that some of the rural areas where it's really easy to attract employees because they're coming from the local community. But here's one that's distinct. So we have a building in Sun Valley, Idaho. And Sun Valley is Sun Valley. It's what everybody knows. It's a ski resort. It's outdoors. It's people coming in with a lot of money. So the cost of housing in Sun Valley is expensive. So a lot of the workers we have at our building there come from an hour away, hour and a half away. So it's making sure that their gas is subsidized. They have gas cards. If they have transportation issues, how do we facilitate it for them to make it easier? Because we're not going to attract an employee based in Sun Valley. The people who are going to attract the Sun Valley are out in the mountain skiing or mountain biking or something like that. But it's all, I think when we look at it, and I look across the board at our facilities, both urban and rural, it's creating these high touch celebratory environments. It's more than a job. It's a family, it's a culture, and it keeps people invested in it. And, you know, I think as we go on, there's more training we have to do. There's more career pathing we have to do. We've looked at this. We've not done it yet, but we've looked at on-site daycare. And I think that's something that will be in our future. We've looked at areas where we could develop housing for employees. Again, haven't done it yet, but it's, you know, one of the ideas that's out there. And we have a couple of betas where we'd be able to do it and test it, that I think it would be something that works. I think that as we go on for sustainability within the industry, operators are going to have to look at that. And it may even be different operators coming together and sponsoring programs together. And I think luckily we have the type of industry where on the skilled side, the competition is not such that operators couldn't join in that to do it together. I think one of the last things, that we've done is employee pooling. And so when a lot of the acquisitions we do are focused on creating regions and creating resource pools. So we're able to share employees across facilities and develop that pooling aspect. And what we found is employees like it. They like the variety. So they can be in one facility for a week, they can be in another facility for another week. And it's a little bit of variety. At the same time, the culture tends to be consistent, so they know what they're getting. And they're not just part of one facility's family, they're part of a regional group of facilities family.
So it's interesting. We're doing a lot of the same things, Steve. I mean, so we're aligning on a lot of this. But we are doing two interesting things. One, all the facilities that I run, the 64, were for profit, and now they're not for profit facilities. So we're doing a lot of work around our facilities to spread that not-for-profit mission in the communities. And I think that has really been encouraging for our current staff. And it's another reason why staff want to join us, because we are committed to our not-for-profit status. But we are doing through Dwyer Workforce Development, because I'm speaking from the two different businesses I run, is we are doing housing. We're calling them healthcare villages, and we've already signed MOUs. Now, this is separate from the facilities, remember, so this is the not-for-profit doing it. So we've signed MOUs in East and West Baltimore, both underserved areas. And a lot of our Dwyer scholars that work in our facilities and other facilities in Baltimore where we place them come from those areas. And, often they're schlepping babies in a stroller on a bus to get to daycare that's, 3 stops past their bus stop, getting back on the bus, going back to their work. They get a call, one of the kids is sick, they get back on the bus. It's like impossible. It's impossible circumstances. So we're going to build multi-income housing, and we've already started the process. We're working on that with childcare adjacent to it, for within walking distance of it. And then we're putting a resource center in each of those areas. A lot of our training, Dwyer Scholar training, is virtual, and their home and Dwyer Scholars home environments don't always support that. So we're creating a resource center that has 15 to 20 computers where people can go and build a community and make their own cohorts and get the support they need. We'll be hiring from the communities to staff the resource centers, and we'll be doing other not-for-profit programming with the other not-for-profits in the area. So for instance, in West Baltimore, we'll be working with University of Maryland, Baltimore, and some of their programming. And we'll do recruiting from those resource centers, and we'll also help at open enrollment, help our scholars understand how to do open enrollment or help with tax time. So I think this purpose-driven communities that we're creating with food access, and now that, I realize I'm talking more urban, but we will be putting them in rural areas as well. We're looking at an urban area also in Houston, but that is what the not-for-profit is committed to, and it's my passion project. And I feel like using these housing villages as workforce intervention will change the staffing issue, because people have they're secure in all those things that present challenges in the workplace.
And I would just say that it's that type of programming, that type of experimentation that I'm a big fan of what the foundation is doing. I mean, and I think it's nice that you have the ability and you have the platform to test these ideas, because I think they're things that we're all going to need, and that we're all going to need to do and participate in as we move forward in finding those sweet spots of what works.
Yeah, we have the unique opportunity of being a not-for-profit workforce development program, and we're finding that we're getting a lot of support from other not-for-profits that want to work with us. We're getting support from government officials. We're able to find grants to do this, and it's a really nice special niche where like you said, Steve, we can try new things. And I think you guys in Cascadia are super innovative, and I'm very impressed the way you guys go about this this culture improvement. And like you said, it's not always about the dollar.
Thank you. And I'll just say, I know, Ben, you're probably ready to jump in. One of the things, and this is on a really micro level, but where I've seen the impact in the last 2 years, we've taken over 20 some odd buildings. And one of the things that we do in every single building that we take over is we have an ops team that shows up at 11:30 p.m. before we're taking over the building. So, right, the stroke of 12 is when your license is going to be effective. And we have a celebration. And they come in, the ops team comes in, they come in with desserts and cakes and refreshments and, all that good stuff. They come in with swag of Cascadia, and they have a party at the stroke of midnight, like it's New Year's Eve, to celebrate. We're here, Cascadia is here, and this is a new order. And it's so funny. That's such a little thing. And in some ways, it's so, it's this little thing that's obvious. It's like, okay, we're taking over, we're the new operator. But operators traditionally have not done this. And I think the employees, and a lot of the employees who've been through 3 or 4 operator changes over the last decade or so, their eyes are wide, and they can't believe that this new operator has come in and they're having a party at midnight to celebrate the workforce joining the Cascadia family. And it's that little thing that on day one, minute one, I think to some degree sets us apart and changes the dynamic in employees' minds. And then you just keep going from there, and it's high touch from that point on.
We also do that as we've taken over the Regency facilities, done the exact same thing at midnight. And it does make a difference. It truly does.
Sound like fun. I'd love some Cascadia swag with your smiling face on it, Steve. I'll give you my address.
I will get you some Cascadia swag, and then I'll get you I don't know, you want an 8x10 gloss?
Yeah, that works. That can be in the background of our 60-second videos.
Do you have a dartboard?
We would never do that, Steve. Well, I think you guys covered a lot of your attracting staff and retention strategies. I do want to quickly touch on anything in the last couple of years that maybe didn't work. Any kind of failed experiments, any experiments that are still kind of yet to be determined their success, any that either of you want to highlight?
So we've only had the facilities for 9 months,
Mhm.
so that's hard for me to speak to. We're only looking positive, Ben. We're just going forward.
Steve.
I think the biggest thing, and this could be hard because status quo and inertia are sometimes difficult things to overcome. I mean, I think the biggest thing is we've had to change our mindset to say business as usual doesn't work. And what worked 4 or 5 or 6 years ago doesn't work. And one of the things, Owen Hammond, one of the founders of Cascadia, 8 years ago, when we set off on the journey that would become where we are now, we had no buildings, and we had a vision. One of the things Owen used to say to me all the time is, Steve, if 10 years from now we're doing the same, we're operating the same, and we're addressing issues in the same way that we address them today, then we would have failed. Without knowing anything that was going to come down the pike, but we all could see the industry was going to change. How it was going to change and the drasticness and the chaos of the change, I don't think any of us imagined, because it was already a chaotic industry. But it has changed, and we do things a lot differently. And I think it's anything that's business as usual and things that you were seeing operators do 5, 6, 7 years ago on a normalized basis. You've got to put that behind, and you've got to say, this is different. This is a different workforce. It's a different psychology of a workforce, and we need to create opportunities differently. From there, I think it's what Barb said. It's wrapping your hands around ideas. Some of them might not work, but I think we need to try. And so I'll toss an example. Will doing on-site daycare work, or will that create more problems? It's possible from a risk management standpoint, because I've had this conversation, it's possible that might create more problems. I don't know enough about the daycare business to fully understand all the risks, but I can see the obvious risks. So it might not work, but I think it's incumbent on all of us to be innovative and try those ideas and do things differently.
Yeah. And for a
I think we
for-profit,
definitely have to address the daycare issue. I mean, women are leaving the workforce in record numbers. There haven't been as few women in the workforce since 1984. Part of it was the pandemic, people staying home for childcare, but childcare is going up. And we're using the models that, like in Baltimore, that Johns Hopkins has a model where they've had daycare on site for years, and it's worked for them. So I think it can work. Again, we're not doing it as a facility. We'll be doing it as a workforce development program that changes that risk a bit, I think. But I think that is something that people really have to have on their radar screens, that this childcare piece, and many women work in our facilities, right? We got to figure out, to retain them, how do we give a safe space for their children?
and Steve, I want to touch on the opportunity or the potential calamity of a minimum staffing mandate. So I just wanted to get your thoughts on why the industry was the recipient of this potential new idea, but also what it can mean for operators, the existing staff and facilities, and then ultimately quality of care. Will it do anything for that? If it happens.
Honestly, I mean, right now, the way number one, we don't know what it's going to say. And I think there's at least some hope that the amount of time that they're taking, and the debate within OMB scoring, and the work that the industry has done in raising their voice about the issue, and getting some key political partners who have also raised their voices. I think it's going to be, and this may be grammatically incorrect, less worse than we expected, or less worse than it could have been.
Mm-hmm.
But I still think when you look at, and this is a common sense analysis conclusion to me, you look at the fact that we're 200,000 workers down from 3 years ago, and demographic demand is only increasing. it's a problem. In 75+% of operators are not going to be able to make a minimum staffing, and they're not going to be able to make it because there's not the employees out there to hire. I think part of the problem is, and this goes, you always struggle in this industry with the question being, what's your biggest challenge? It's labor, it's reimbursement, it's regulatory. I think our biggest challenge is our perception, and our perception amongst the public, our perception amongst legislators, and our perception amongst bureaucrats. And I think we're highly misunderstood. And we're an easy target for people who want to make political hay, because we get 95% plus of our revenue from Medicare and Medicaid. So we're beholden to the government, and we're easy to hold. We're an easy target to hold your feet to the fire. And we take care of elderly, we take care of vulnerable adults. And so again, it's easy to look, and it's easy to look back at 3 years. People don't want to talk about where the government is our partner, where none of us were ready for a pandemic. They don't want to talk about the lack of PPE. They don't want to talk about testing. Now what they want to talk about is everything we did wrong, because nobody else had a hand in that. And the government is our partner, didn't have a hand in that. It's all you, the operators. So how are we going to fix it? And how are we going to hold you to account? Let's have a staffing minimum, because that makes sense, because we don't have the people to populate that minimum. So it's super frustrating. And I think we're misunderstood. I think that we're a convenient target for people who have certain political agendas. But again, I will go back. I'm hopeful that the time it's taking is going to give us some runway. And then we're going to have to address it as an industry. And I think we're going to have to address perceptions, and we're going to have to address how we solve whatever problem it is they create for us.
Mm-hmm. Yeah. And addressing perception will surely help attract staff as well to this industry.
I think that's a big thing. And that's one of the things where we try and position ourselves in markets, because hospitals tend to be a more, and I know that there was a question in the box about non-healthcare employers like Whole Foods and Apple. One of the big ones we've dealt with in Idaho is Amazon and Amazon fulfillment centers. That's hard. I think, for us, in part of our recruiting and retention is about healthcare. And it's about celebrating healthcare and celebrating culture and celebrating the people who would want to make that choice. Because I think the people who commit to this industry have a different mindset than somebody who wants to work in an Amazon fulfillment center. And that's okay. I mean, there's people who are suited for one, and there's people who are suited for others. We have to find and celebrate and culturally uplift the people who are suited to come into our facilities and provide care, because they're going to get something beyond just a paycheck and extra job satisfaction, because they're providing that care.
Steve, the perception is reality, right? And perception is the problem, 100%. And, we're in a fixed rate business, right? And until decision makers recognize that seniors are important and, need to get the support they need, it's going to continue to be a problem, I think.
That perception in an interesting way is one of the challenges I deal with a lot. And Ben noted, speaking in front of the Idaho legislature, our governor in Idaho has a very strong budgetary financing disposition towards children, which is great. And I have children. I love children. I love education. I love public resources for children. It's definitely necessary. But one of the things that we're trying to make impactful change of perception about is, hey, how about our elderly? How about the greatest generation? How about our grandparents? How about these people who've given their whole lives into the system and into communities? We need to take care of them too. And they're an important subset of our population that we need to be attended to. But it's changing that perception, and that's one. And it's not an either or, but you look at some of the things where if COVID had impacted children in the same way it impacted elderly, we wouldn't be having this discussion about staffing minimums or funding or any of this stuff. There would be all the money in the world to have addressed that issue. And I think now coming out of it, that's probably our biggest challenge, is changing that perception. So we change the partnership with government and we change the partnership with community.
And to our last segment, which we only have about a little over 5 minutes to answer. We'll stay definitely a few minutes late today, but I wanted to touch on the impact on returns. So from an investment perspective, which a number of our audience members are surely interested in, most investors have already taken a hit on returns, just given the rise in capital costs. So in terms of labor in the long run, or at least in the next 5 years, Steve and Barb, do you think that investors are going to just have to accept lower returns due to staffing costs? Is that just a reality?
I don't, in the longer term, I don't think it's a reality. In the short term, I think we're all dealing with a variety of unique factors that come into play. Coming out of the pandemic, the inflation environment, the rate environment have all conspired to create, I think, what's a short-term period that's maybe not the most advantageous to investors. But I think the long term, accepting higher wages is in the long term going to help us be sustainable for increased demographics and increased opportunities in markets. And even though, I mean, from our standpoint, the supermajority of our portfolio is skilled nursing, but we now have 10%, 15% of our portfolio is ALIL memory care. And that's going to increase because we made a commitment to that service line. I think that there's lots of opportunity there. I mean, you all write about it and talk about it. There's lots of opportunity in the middle market, in the lower end market for senior housing and private pay senior housing, and how we're going to finance that and how investment's going to play into that are open questions. But I think ultimately demographics is going to drive sustainability and profitability. And if a little bit comes off that for labor in order to create sustainability, I think that's going to be ultimately a drop in the bucket, because there's a lot of people that we have to provide care in housing to, and ultimately it's going to become more profitable.
I feel like if we continue to be creative about these solutions to the staffing issues, that will make a big impact on the shortages. You know, like you said, Steve, short term, there's been a bunch of issues that have made it where it is today. But I think in the thought process about being creative and doing things like we're doing in the workforce program, and like Steve's doing there with his culture, and we are doing the culture at Regency, I think these things will fix it. And I don't think this industry, some of the perception might be deserved because this industry hasn't been progressive about like corporations, like creating culture and looking at culture as something essential, and looking, you know, at the greatest companies that exist in the world and what they're doing to keep their staff, and then duplicating it in this space. And I think we're seeing more of that now. And if it continues, I think it will move the industry forward.
So what still needs to be done in the industry and at your own companies, just across all senior care sectors? What still has to be done so that we don't have to have another webinar on this exact same topic with you two in 2 years?
I'm going to say everything we talked about, pretty much. And you know, another thing, before I was the CEO of this not-for-profit and started it, I was in the communications business and ran a company for 18 years that I started, a national communications company. And I think part of it is around perception and promoting healthcare careers in this space as you know, like really doing concentrated effort around marketing this career choice and this career path, and reaching out to people and helping them understand that it's the fastest growing sector career wise, and you can make money here. And so I think working on perception itself will make a big difference.
I agree. I think it's all of the above that we've been doing. And I think it's continuing to move in an innovative fashion. And again, and Barb touched on it. I think that we were an industry that for a long period of time was super static in how we operated. The 90s and the first 10 years of the 2000s, I having been in the industry and seen it, I don't think that there was a lot of innovative change. And there weren't a lot of newer operators creating these examples. And I really think that, and I think a lot of things conspired to do it. I think the industry was changing, acuity was changing, regulatory was changing, that forced operators to get out of the boxes that they were in. And then the pandemic has changed us even more so, but I think there's no looking back. There's no business as usual. There's no, we're going back into the box that we were in 2018. To be sustainable, we're going to have to continue to change. And one of the biggest things, so we don't end up here in 2 years or having conversations about what went wrong or what didn't work, is change perception and get people to think differently about who we are and what we're doing. And and I think the things that Barb and I have talked about, and the things, some of the really innovative things they're doing, I think will continue to get us there, because we're going to have more case study to look at and say, they're doing this and that worked. We need to do this, or we need to build on that and do something that takes it to a different place.
Yeah, I don't want to have to have another webinar in 2 years about the labor struggles in the industry. I want to have a webinar with you two in 2 years talking about the wild successes of all of your pilot programs, workforce housing, daycare services, employee retention skyrocketing to 100%, all of that good stuff.
So do we.
Well, I want to
let's get it on our calendar.
Yeah, absolutely. Well, I want to give both of you just one kind of last opportunity to basically, if the audience had one takeaway from this whole conversation, what do you want that to be? Steve, do you want to go first?
Be innovative, think out of the box. And I think the biggest strength that this industry has, the biggest strength this industry has, and it's across skilled and assisted, is that we're a collegial industry. And so let's keep talking. Let's bring our voices together, whether it's through our associations, whether it's through conferences where we all meet up. And we know there's a half a dozen of them where there's 2,000 of us there. Let's keep our voices going, because we're in this together. And what lifts one of us is going to lift all of us.
And Barb?
I hate to repeat it, but I think that Steve's right on, which is the innovation and then sharing voices. The other thing is, as we grow this workforce development, not-for-profit across the country, we want to work with people and figure out ways in each. I mean, we're going to be a national not-for-profit, and as we expand, we want to team with people in this industry and work together to solve this problem. And we're finding that our relationships, now I'm speaking as my not-for-profit hat, our relationship with providers in these different markets and their willingness to work together as a team to tackle issues is moving the industry forward. And I think that as Dwyer Workforce Development expands across the country, we put our heads together. When we get to Steve's area, I don't know, Steve, we could work together with Dwyer and Cascadia, and what could we create? I mean, it would be amazing.
I'm ready.
And then we'll do a webinar on
it. There it is.
Well, definitely ending on an uplifting note, which is fantastic. And as we mentioned, the labor problems are getting better. Still a lot to do, a lot of experimentation, but definitely already some success to report on, which is great. I want to thank both of you for joining me again today, just like 2 years ago, and just like again in 2 years. I want to thank our audience for tuning in today, for asking some great questions, and for anyone still on the call, if they want to feel free to follow up with additional questions or any comments. That is always greatly appreciated. The survey that will pop up at the end of the webinar, if everyone could fill that out as well, we will take note of all of your comments. And with that, thank you both again. A great conversation, and we'll talk soon.
Thank you.
Thanks, man. Thanks, Barb.
Yeah,
Great to
thank
be
you,
on this
guys.
with you.
Thanks you both.
Take care.